So hello everybody, Steve the Hurricane here. Super excited for today's webinar, and there's going to be about 200 or so of us on the webinar, which is amazing. So as everybody's piling in, I'm just greeting you, and I love it when you're on live with me because you're going to get to interact with me. And so I'm using the webcam for those of you who are live with me, and those who watch the recording unfortunately won't get the webcam, but we'll still have a good time either way. But first thing I want to do is I just want to say thank you so much. I'm in such great festive spirits. I actually, yesterday, it was crazy. I flew out to St. Louis with my real estate business partner out there. He's in Sacramento, but we're working together on a property, several properties actually in St. Louis. And so I flew out yesterday morning from Philadelphia at like 7 a.m., Then I went back to the airport last night at like 4 o'clock and then flew home and got home last night at like 10 o'clock. Woke up this morning at 5 and just started to go right to the grind. And I texted many of you and we're emailing people and everything. And I just want to take a moment and just say thank you because I've been getting all of these like Christmas cards and holiday cards. You know, thank you from everybody down to Visiting Angels in West Virginia. You guys are awesome. Hillary from the Visiting Angels here in New Jersey, thank you so much for this beautiful card. Beautiful children that you have here. It's wonderful. We've been getting gifts. Check this out. I have this delicious assortment of chocolate-covered pretzels that I'm going to be eating, so that's fantastic that I haven't eaten yet. And I want to give a big shout-out to Brandy Kurtaka, Nathan Kurtaka, and all of my friends at My CNA Jobs. They sent me wine. It came in the mail today, and so since you've all seen the show, A Drink with the Hurricane, I'm going to do this webinar. It's the holiday season with a glass of wine. And so you get to have a live drink with the Hurricane. It's going to be fantastic. Yes, folks, I truly love what I do for a living, as you could tell. So cheers. Happy holidays. Happy Hanukkah. Merry Christmas. And here's to a prosperous 2019. Let's make 2019 our best year yet. I see these people jumping. Everybody who's jumping on, like, wait a second, he's gonna have some. He's drinking on the webinar. Yes, cheers to 2019. It's going to be an amazing year. It really is going to be an amazing year, and so I'm just very excited to have you here. Oh, look at you, you're already commenting with me. Cheers. Yes, Sharon. I cannot wait to see what's going to happen for you in 2019. It's going to be amazing. And, folks, as we're getting started here and everybody's populating in, like I said, there's about 200 of us who are registered for this webinar live, and people are constantly coming in as we speak here. So I want to make sure that you understand this is going to be an interactive presentation because I want you to be focused, pay attention. I have about 60 slides to get through in less than 60 minutes, in 55 minutes, but I will shoot through the slides because a lot of the slides are just bringing up things I'm going to reference from stuff that's been going on this year and trending over the last couple of years as we get ready for 2019. Because I do want to say this is going to be an amazing year, but there are some things that we have to take note of and we have to make adjustments because it is an evolving, changing industry, and if we're not focused and we don't do things carefully, we could have a big problem next year because there are a lot of negative things that are also happening in our industry as well. And so that's why I put this webinar together. Now, I want to just make sure that you all understand how to interact with me. So if I ask you a question, you can respond to it. Just where you see like the little questions pane on the GoToWebinar platform, just go ahead and type yes so that I know that you can interact with me. So if I ask you a question, you can respond to it. Yes. I see the yeses coming in. Excellent. Good. So you all can interact with me. That's fantastic. So if I ask you a question, you could go ahead and type it in there, and this way I can see it. And also, too, at the end, depending on how much time I have, because I got an appointment right sharp at 2 p.m., so I have to jump off the call and go right on to another call of one of my mastermind clients. I've been doing mastermind calls all day long, but at 2 p.m., so I have to make sure I jump off right at 2 p.m. But if I get done early and you have questions, put your questions in here, and I will go to the questions and answer whatever questions I can before I have to jump off and get on to my next appointment. All right? So let's jump right into this. Very excited for this presentation. There's a lot of great content in here for you. So let's start the show. All right? So State of Home Care 2019. Like, what's coming up? What can we expect from the home care industry in 2019? And for some of you, you represent a home health company or a skilled agency, that's fine. The very first little piece of this does not necessarily pertain to you, but the rest of it does. And then for people who are private duty home care, the entire thing focuses to you as well. This is a presentation that I wrote and I put together using lots of notes and lots of resources. I hope you have a notebook and a pen because I'm going to fly through this, but you want to write things down so that you can go back and reference it and check for your own organization, because I'm going to be bringing up a lot of things based on industry trends that we need to make sure that we are prepared for as we enter the new year. All right, and so obviously I'm the president and owner of Hurricane Marketing Enterprises. I will tell a little bit about my story in a couple of seconds, but this is my company. Do I want you to work with me? Yes. Half of you are clients of mine. The other half of you aren't, and you should be. So I'm just going to throw that out there and move on, all right? I want to give a very special thank you to Home Care Pulse. You actually see in my hand I'm holding the 2018 Home Care Pulse report. All of the stats that I show you, this is how I put this presentation together. It all came from this book. This benchmark study, they surveyed around 1,300 locations in the United States. All 50 states participated in there, and all the stats I'm going to show you on caregiver recruitment and retention and how to keep caregivers and all of that stuff, all of it came straight from that book. And so I just want to make sure I give them the thank you, because if they didn't do this, it would make it a lot harder to get this information and have an idea as to what's going on in our very special but somewhat volatile industry. So these are the things I'm going to cover during this next hour with you. We're going to talk about the rising cost of providing home care, because it is expensive and the costs have been going up year after year after year. So I just want to give you an idea as to what to prepare for when it comes to budgeting for next year. We're going to talk a little about recruitment and retention. I'm going to focus more on the retention side, because when you see what I have to say about the recruitment and how much money we spend recruiting, what good is recruiting if you can't keep caregivers? Like that's it's almost like people say to me, Steve, I want to have more referrals come in to grow my business. This is a common thing that I face all the time. I want more referrals. Okay, what are your conversion ratios? Oh, we don't know what our conversion ratio is. And I was like, well, then you don't want to bring on more referrals if you don't know what your numbers are. If you know what your numbers are and they're poor, let's get the conversion ratio better, and then we'll bring on more referrals, not have more, throw money at something to have it come in. So there's a way to go around it. And then I'm going to talk on the Medicare Advantage, because I know you're all excited about that. I'm going to tell you what I see in the business, what I've heard on the street, and things to just take a look at. And if you want to be able to participate in it and get it, some things you have to do to get ready for it. And then whatever time I have left, I will answer any questions you have. If not, maybe I'll do another one of these early in the new year where I'll kind of recap this, but I'll do it for a little bit longer, where I don't have like 60 appointments in the one day, and then I can do another Q&A at the end for you there. So are you ready, folks? Yes? You're going to type yes for me? Yes, are you ready? Do you have a notebook and a pen in front of you? Yes? Are you ready? Good. All right. It's so funny. If you could see my go-to webinar, if you could see 100 yeses come up all at one time, it's actually kind of comical, all right? So here we go. This is the problem with the industry, all right? The problem with the industry is we are trying to grow our businesses, but there are a lot of things that are happening that are holding us back. I don't think there is a single person on this webinar right now that has enough caregivers. I don't think there's a single person on this webinar here right now who wouldn't give whatever they had to give to get and keep more caregivers, to get and keep more patients. Like, I want to grow my business, but those are the problems that we're facing in our industry. Regulation changes, minimum wage increases, and so therefore to be able to get people, like I was actually talking with my mastermind group. I had a mini mastermind meeting here in my office last week, and everybody was talking about how in their areas, Amazon has moved into their area and Walmart warehouses, and they're paying, $14, $15 an hour. And so now they have to compete with that because the caregivers are leaving them as home care providers to go work at Amazon and make the same, if not more money, and that's becoming an issue for us in the end. That's a big problem. And I said, well, you have to think, these big companies like Amazon and Walmart and Target and so on, they've had years to prepare for this. They're kind of like the people leading the charge because they saw what was going on in the industry and the labor changes, and they just said, all right, $15 an hour, let's just make this standard straight across the United States. But that is a big problem that affects us, and we have to be able to handle it, and we have to know the statistics to be able to do so. All right, now check this out. This right here, this is where I'm seeing this is a big part of the problem. When you look at like 5 years ago, home care was a great business to be in because you would grow your business by on average 15%. That was the industry rate of growth. But then all of a sudden, look, it's been 10%, 10%, 8%. Now it's down to 7% in 2017, and I wonder what the growth rate is going to be for 2018 when the year is finished and the data is collected. I think it's going to be around the same. So if you look, our industry is on a downward trend. That's a big problem. All right. Now, who am I? For those of you who don't know me, because most of you don't know who I am, I did this. I owned a business for many years. From 2005 to 2009, I was the Director of Business Development, a marketing position. I became the Vice President, part owner in 2009. We flipped the company for several $1 million in 2011. I was part of a larger system. I then helped train other people. Everybody's numbers went up. 2012, I left, and that's when I started Hurricane Marketing Enterprises, and I am Steve the Hurricane. I got that nickname from Brian, who owned CareChoice. Back in 2006, he gave me that nickname, and I just took it and ran with it. I have actually calculated through the number of clients and people that I've trained. I've trained thousands of individuals all around the country and internationally. We have clients in 6 countries now. I'm responsible for almost $1 billion in home care sales and revenue that has been generated by people using the things that I train them on. So I know a thing or two about this, and I wrote the book, Why We Care. It's actually right here. I'll show it to you. All the profits for this book go to the Institute for Dignity and Grace, my nonprofit, and it's all about advocacy for the seniors. It's a great book. It's on Amazon. You can get a great Christmas gift for somebody. And again, the profits, it goes to the nonprofit for advocacy for our seniors. So if anybody hasn't read it, it's basically the book of home care, how to choose an agency. But really, it's a collection of stories for myself and 8 of my clients all around the country, sharing all the stories of the people that we take care of each and every single day. So I highly, highly recommend it. Like I said, it's $15 on Amazon, or you can get the electronic copy for less. But all the profits go to the Institute for Dignity and Grace. And I've been getting feedback a lot. It's a bestseller. I've been getting feedback, and people, they like it. I was like, wow. Like I wrote the book, and I was like, oh, yeah, I like this book. But then people read it, and they're like, this is a great book. I love it. I love the stories. I shot through it. It was a quick, easy read. It took me 2 nights or whatever. And I'm like, that's perfect. That's great. So if anybody likes to read great, heartwarming stories felt in there, I highly recommend getting the book. You can get it online. All right. So, whoops, I don't know why that came back up. There we go. All right. So, my story, I already talked about it, but I want you to write this down. Referrals equals freedom. You probably heard me say this before. Write that down. Referrals equals freedom. Referrals equals what? Freedom. That's right. 200 people around the country just yelled out freedom in their office, and that's what I wanted you to do. I hope you did that. Referrals equals what? Freedom. The more referrals you have coming into your business, I learned this a long time ago, the more control you have over your business. You have more control over what you charge. You have more control over what you're paying. You have more control over your shifts. You have more control over how you run your business when you have an abundance of referrals coming in. If you don't have an abundance of referrals coming in, you are limited in what you can do. And that is where a lot of the problems come in. Like, I'm going to be honest here. 50% of the people out there who own a home care business should own a home care business. And 50% of the people who own a home care business shouldn't own a home care business, because this is why our industry is so volatile, because there's a lot of people who shouldn't be doing this who are doing it, and they don't understand a lot of the things it takes. None of you, but they don't understand a lot of things it takes. And you know this because you know your competitors. You know the ones that are good, and you know the ones that you were kind of worried about taking care of a senior, right? You know what I'm saying there. You can understand what I'm saying there. So the more referrals you have, the more control you have over your business. Always, always remember that. If you remember nothing from this, remember referrals equals freedom, all right? Hurricane Marketing, this is why I started the company, blah, blah, blah. And I just want to show this to you. Remember I told you before about the average industry growth is 7.7%, and my clients' average growth is 5 times that. That is what my clients average because of the things that I'm talking about. So what you're going to get here on this webinar is going to be impactful and powerful to you and your organization, all right? And these are just some of the happy people, all people. Hey, yeah, Stacy, see that lady, right? Here we go. And more and more and more, all right? So let's address the rising costs. This is a big part of it. How much is it going to cost me? Well, it all depends on what you want to do. And you've heard me say this if you've ever been to one of my boot camps, where I say you should spend about 5% of the revenue you wish to obtain on all things sales and marketing to get your business. If I want to have a $3 million business, I should spend about $150,000. That's 5% of $3 million. Marketing rep salary, good website, SEO, social media company to manage that for me, tchotchkes, lunch and learn in services, collaborating on events, sponsoring activities. All the things that I just said should cost you 5% of the total revenue that you're trying to obtain. And so that's really, really important when you think about where you want your business to be in 2019. Now let's take a look at some of the numbers, all right? How much does it cost us to get a client? You see, here's the 5-year look back. The last 5 years, from 2013 through 2017, it has gone up 20%. It was less than $500, and now it's $600. That's a 20% increase in the last 5 years, which is pretty high when you think about, standard rate of inflation. That's pretty high, 20% growth in the last 5-year look back. Stuff doesn't usually go up that rate, but that's what it costs us to get clients. It's harder now to get clients than it used to be. There's more competitors. There's also more options available. There's assisted living. There's senior living homes, and I was in St. Louis. I walked into a brand new care home, which is like the future of nursing homes, and oh my God, it was amazing. And if I had to pay what they were charging for permanent placement, like I would never put my mother in a nursing home. But if my mother needed to be in a nursing home and this place was available for $320 a day, I would have my mother be there because it's nicer than the place that I pay for, which is her apartment. I pay for her apartment. My mother had a massive stroke. She's in her 60s. She's on Medicaid. I'm paying for everything. But if I had to put her in a place, that is a place that I would put her in where she would be happy and well taken care of all the rest of her days. So yeah, it costs us a lot of money to get the clients that we're after to grow our business. Now, let's show you what your return on investment is per client, because this is something that a lot of people don't realize. Oh, actually, this right over here is the actual median cost of getting a caregiver. So it costs us $600 to get a client, but it also on average costs us $550 to get a caregiver. And you see all the different ranges here of places where you can get a caregiver from. So when you look at, my CNA jobs, I give them the shout out. They're the ones that gave me the wine, right? But theirs is the lowest, but even still, theirs is $470 to get that caregiver. So the average is $550. So if you think I want to get 100 clients next year, 100 clients, that's going to cost me $60,000 to acquire 100 new clients. Now, again, part of that is marketing, rep salary, SEO, all the things. It's all factored in there. But 100 clients will cost me $60,000 in revenue. 100 caregivers, if I want to hire 100 caregivers, that's going to cost me $55,000 in revenue. So to grow my business by 100 new clients signing on 100 new caregivers, that's $114,000. And so it makes sense as to what I was just saying before, how I'm going to spend this kind of money if I want to grow my business accordingly. And some of us on here are probably thinking, whoa, $114,000, it's not all at one time, but break that down. That's about $10,000 a month, right? There's 12 months in a year, so it's a little bit less than $9,600 a month, I think, is what that actually comes out to. Now let's look at return on investment. So I bring on these 100 clients. What is my business going to do from these 100 clients? And this is where I've been talking about this all year since I found this stat. You may have seen this before, but whoa, if you've never seen this part before. 4 years ago, it was $11,500 as a return on investment. 100 clients, $1.2 million in revenue. Year later, pretty much the same thing. 100 new clients, $1.2 million in revenue. The year after, 2016, pretty much the same thing. It went down, but nothing significant. So again, 100 new clients, $1.1, $1.2 million in revenue. But then look at what happened. All of a sudden, it dropped down dramatically. It went down to $8,000 return on investment. That's 25% drop. 25%. So here I just talked about how it cost me more to get caregivers than ever before. It cost me more to get clients than ever before. And my return on investment is 25% less than it was the 3 years prior to this year. And I'm interested to see if we've turned things around as an industry. I'm hoping that we've turned things around as an industry, but this is where you have to look at your conversion ratios. You have to look at what's going on in your business. And again, I'm not sugarcoating anything. These are the stats. So this is what the data is fed, and I'm sharing it to you, and you take of it what you want. But as you're looking to prepare for 2019, take a look at what your current stats are, and if they're trending this way, we have to make adjustments somewhere. That's what this is. This is a planning webinar, all right? And I'm going to ask you, are you getting a lot out of this so far? Like, are these things that you've looked at in your organization internally? Because this is the industry rate. But have you looked at this yourself? Is this good? Good. Type yes if this is good. All right. Good. Well, I'm glad that you're enjoying it and you're getting a lot of stuff here from it then, because that's what it's all about. All right. So now look at this. If 2015 and 2017, if you had 100 clients, like I said, that's $1.1 million. Now, 100 clients is only $800,000. That's $300,000 less. That's your 25% that I talked about before. All right. Now, if you need help, reach out with us. We're here to help you with this. If you are one of our clients, reach out and make sure that you're talking about this with your coach or the training programs or whatever, but make sure you look at your numbers. Look at your numbers and see if they're with the industry or if they're not. If they're not, then you're good. If they're not, then that means it's great. Everything is good. You don't have to fix something if it's not broken, right? But if your numbers are going along the trend of the industry, if they're going down, that's where you have to take a look and prepare for something different in 2019 to turn things around and go back. You may have kept the same amount of revenue as you did the year before, but your profit margin is what you're losing. And we don't want to lose the profit margin because we're in business. We spent enough money to get our business started and run it, and all the risk is on us. Believe me, I understand what that's like. I'm an entrepreneur myself, all right? So next thing I want to point out and talk about, recruitment and retention. Cheers. Right? Okay, so recruitment and retention. This was such an eye-opener for me. And you're gonna. I hope you like what I have to say, but I want it to resonate. All right. So here we just talked about before. This is just a reviewing that slide I showed you before. What it costs us. These are all the places that we go for caregivers: internet, Craigslist, MyCNA jobs, word of mouth reputation. Look at that, word of mouth reputation. That's important. I'm going to touch base on that one in a little bit. But again, still. It's costing us $550 on average across the country to get a caregiver. Now, let's look at how much revenue a caregiver brings into our organization, because the caregivers are our workers. This is our workforce, right? The average financial lifetime value of a caregiver is $12,000. So now think about this for a second here, folks, right? And what's the average lifetime value of a client? $8,000. So a caregiver generates $12,000 in revenue for my company, and a client generates $8,000 in revenue for my company. So that means that for every client, or for every, say, 3 clients, that's 2 caregivers, right? Because one caregiver can only do so much, and they're only with us for so much time that they generate this amount of revenue for the organization. So it's almost like 1.5 to 1 is the ratio. 1.5 clients to 1 caregiver. Now, I think we can do better as an industry. I think we have to do better as an industry, because also look at these numbers here. When you look at based on the revenue. So if my business is doing $800,000, a caregiver only brings in $9,000. If my business is in the middle of the pack, 800 to 2.8 million, A caregiver is about $12,000, which is where the average is. And then if I'm a leader, I'm doing things a little bit better than the average, which makes sense. If I have a $5 million business, I probably have figured out things that smaller businesses haven't figured out. My caregivers are worth $16,000. But everything is still proportionate to about 1.5 clients to caregiver when you look at the rate of return on the revenue on the very next slide, depending on where your revenue is, all right? So here's where it costs to get a new case. When you get a new case, using the numbers I just said, right, 3 clients, 2 caregivers, because that's the 1 to 1.5 ratio. That's where this number comes up. So 3 clients, it's $590 per client. That cost me $1,770 for 3 clients to acquire and start 3 clients. It also cost me to get 2 caregivers, because that's the industry average, to take care of 3 clients, at $1,100. It's $550 a piece. So it's $2,870, which means every time you start a new case, you start off $1,000 in the hole. I know. You're probably like, holy crap, like mouth hung open. What? The math is right. The math doesn't lie. This is why I love doing these kind of webinars, because the numbers don't lie. When you look at the statistics, now here's what you have to do for yourself. You have to take a look at your numbers. That's how do you take this webinar and get the most out of it? Look at your own numbers. It's year end. It's year review. You should be looking at. I look at my P&L statement probably about once every week to 2 weeks. Take a look at it. Where am I spending money? Where is it coming in? What is the number? What's my profits? Do I have a lost month? Whatever. These are all things that we should be doing. So how much does it cost you to get a case? And so I just showed you the return on investment is down 25%, but it automatically costs you $1,000 every time you start up a new case. So just think about that. And I don't want to discourage. I don't want you to think like, I'm in the wrong business or whatever. We're all in the wrong business, right? No, we're in the right business. Just be smart about it. Be prepared about it, right? This is what this is all about. I'm being truthfully and honest with you so you know how to prepare for the next year, because I want you to do well. I want you to be top dog in your area. I want you to take care of more patients and keep those people home and out of the hospital. That's what I want you to do. So I know you're in it for the right reasons. Just be prepared for it and understand these these are industry average costs. So are my costs on par with what the rest of the industry is? If I'm under, great, God bless you. You are lucky. Thank the Lord for all of your blessings, all right? If it costs you more than this, then you got to do things a little bit better to drive down those costs so the business is healthy for the long term, all right? I want you to think about this too. You see how much it costs you to get a caregiver? What is your retention rate? If you can't keep caregivers, should I keep recruiting them? Or should I fix what's wrong in my organization and then start recruiting them? Right? Answer that question for yourself. You don't have to put it in here with me. Just answer it for yourself on the paper. If I can't keep caregivers, should I keep recruiting them, considering it costs me $550 every time I get a caregiver? If I can't keep them, do I keep recruiting them, or do I fix the problem first? Just think about that, all right? Here's your caregiver turnover ratio. Look at this. It's horrible. That's a joke, right? 66.7%, and it's closer to 70% in 2018. So it's getting worse. It's not getting better. That's a bad number. That means if you hire 3 caregivers, by the end of the year, if you hire 10 caregivers, by the end of the year, you'll have 3 left. That's a problem. And don't blame the caregivers. All right? We have to take responsibility. This is our problem. Why is it an industry problem? It's because the industry created the problem. All right? I'm going to talk about that in a couple seconds here, because I'm going to give you tips to how to overcome this, because I actually have to say I'm very proud. One of my mastermind clients who I was speaking to last week in Jersey, her turnover ratio is 33%. So it can be done. She's in New Jersey, 33%. That means if she hires 10 caregivers at the end of the year, she still has 7 left over. All right? That's fantastic. So it can be done. You just have to take action on how you're going to do it. All right? And treat caregivers with dignity and respect. I'll talk about this in a second. Look at this. Caregivers who quit during the first year of employment. So I'll bet 7 out of 10 who quit within the first year, right? 7 out of 10, almost 60% of those people quit within the first 3 months. So you spend all this money to get the caregiver, you send them out to a case or two, whatever processes and things you have in your organization, they're like, well, screw that, I'm not doing this, and then they just walk off the job, or they don't show up, or they're gone. Then look at the next group, 4 to 6 months, another 26%. So basically, 80%, when you add 57 and 26, right? More than 80% of the people that we hired, 80% of the people who quit, so out of that 7 out of 10, we'll say 5, 6 of the 7 who are going to quit leave us within 6 months. Talk about a waste of money, right? What did we do? Because think about it, folks. Just think about it. I know some caregivers, yes. Some caregivers, yes. But think about it. This is a person who's coming into my organization who wants to work here. What is happening in my organization that they quit within 6 months? And you have to think about it from your perspective. If I was a kid, like put yourself in their shoes. If I'm a caregiver, would I want to work here? And be honest with yourself. Answer that question for yourself right now. Write it down. If I'm a caregiver, would I want to work here? What do I do for my caregivers that would make me want to work here if I was a caregiver? If you can't come up with a solution to that, then that's the problem. That's the problem. Then don't stop hiring caregivers and fix the problem, and then hire caregivers that you can retain and keep. I can't stress that enough. Fix the organization. Look at this. Here's region, right? Northeast region. Woohoo! You're doing good. Our caregiver retention rate is 50%. We're not great. We hire 2 caregivers, we keep 1, right? For every 10, we keep 5. So we're doing great. But the rest of the country, good Lord, the southern and the central, which is Texas. Come on, Texas, Colorado, 79% turnover ratio. Colorado, you keep 20% of your caregivers. What? Florida? Come on, Florida. 77% turnover ratio? Yeah, there's some problems out there. And the problem is more than the caregivers. Yes, think about a caregiver, folks. Let's be real. A caregiver is not a college-educated person. A caregiver is not a professional in most instances. A caregiver is somebody who has a high school degree or a GED, right, where they got their high school level education. They went to a certification class, which is about 80 hours, 2 weeks of time, and then we take this caregiver, we give them a client, we give them a plan of care, and we expect that caregiver, this person who's not professional, who's not college educated, to be able to manage that client independently for what, 2 months before we stop out there and see that client, that caregiver again? That's the problem. That's the problem. It's not fair. It is not fair. We're taking people who are ill-equipped to manage themselves and another person and expecting them to do so. I can't say it any clearer than that. That is what we have to take a look at and think about it. Now, some caregivers are amazing. Some caregivers can figure it out. That's why we keep 30%, 20% in certain markets in the United States. I'm really disappointed in the West Coast. Really disappointed in you guys because 50% to 70% almost, that's bad. You guys are supposed to be better than that. California, Washington State, Oregon, right? It's expensive. And here, look at this, folks. Just think about this, right? Because everybody talks about, it's the money. Caregivers want more money. No, it's not. No, it's not. California is a $15 minimum wage state. So is Seattle area in Washington, right? So they are in places where caregivers have to get paid $15 or more. I know people paying $17, $18 to their caregivers in those areas, and they're still turning over 70%. It's not about the money. It's not. Just think about what I said. Let that sink in and resonate with you, right? Should I keep recruiting caregivers if I can't keep them? No, you shouldn't. Fix that. Fix that problem. Get it to 50%. Get it to 33%, like my mastermind client, right? Do that. Create the culture in your organization that retains excellence. Create it. do it. Do whatever you have to do, because when you do that, you are raising the standard of the industry. And this is straight across. This is not my home health and my hospice friends who are on here. It's the same thing. The turnover ratio is the turnover ratio. You know, caregivers. Some of you have nurses. They turn over too, right? Office staff. How many of you have office staff problem keeping office staff, right? It's the whole culture. It comes down from the top. If I can't keep office staff, and I have a revolving door of schedulers and recruiters and receptionists and people coming into my organization, HR, that's a revolving door. No wonder my caregivers are turning over left and right. How are we managing our caregivers? If I can't keep caregivers, should I keep recruiting new ones? Just think about that, all right? These are important questions to ask yourself as you're reflecting on 2018 and you know your stats. First, find your stats, then reflect on these questions. Now, here's why caregivers work for an employer, right? First job they applied for. But look at number 2. First off, look at all of these. Is money any of them? No, it's not. Not a single caregiver said my reason for working with my boss is because I'm making good money. But they do it because it was either the first job they applied for. Okay, that's just, reputation or whatever. But look, good working environment and benefits. So the people who retain like the working environment and the benefits. Now, these are probably to the good agencies, right? The company was recommended to them. The company has a good reputation. I'm going to say 3 and 4 go hand in hand, because why would somebody recommend you work there? And think about it. This goes to the word of mouth that I was talking about earlier. So why would I work for you and then recommend my friend to work for you if you didn't have a good reputation? So that goes hand in hand together, all right? And then working schedule met lifestyle. They like the flexible hours. They can be there to put their kids on the bus in the morning. They can drop their kids off, or they can be at home when the kids get off the bus, help with homework and everything else. It met their lifestyle. Now, I want to show you something. This right here, this is the problem with the industry right now. And this goes back to closing and conversion. This goes to minimums. Caregivers, if you're lucky enough to get a caregiver to stay with you to a point where you can get them to 40 hours a week, this is a typical schedule for a caregiver working 40 hours a week. We'll just say this is Denise. And Denise has Bob Monday, Wednesday, Friday from like 8 to 12, and then Jill Tuesday and Friday from like 1 to 5 or something like that, and then Kelly, same hours, Tuesday, Thursday, and then Robin 1 day a week from 2 o'clock until 6 o'clock. And then Tony, Tuesday and Thursday from 8 to 12, something like that, right? It's 40 hours a week. Now, I want you to put yourself, just close your eyes for a second here. I am a caregiver. I am Denise. I am Denise, the caregiver. Okay? So imagine that you're Denise, the caregiver. I'm working 40 hours a week. Now, we know Denise is a caregiver. She's making a little bit more than the minimum wage. So think about your lifestyle that you have yourself. Could you live off of a little bit more than minimum wage? The answer is probably no. Okay? Or if it is, you're going to be paycheck to paycheck. It's going to be tough, right? Like, just put yourself in Denise's shoes, all right? Put yourself. I know most of us are owners and marketing reps making a lot more than a caregiver. Imagine you are Denise, you are a caregiver, how much it costs to live and how much you're paying her, all right? So imagine how much you pay your caregivers if you were the caregiver. Now, look at the screen and watch this. Kelly died. Kelly was now Denise's client Tuesday and Thursday from 2 o'clock to 6 o'clock or 1 o'clock to 5 o'clock. Now, we can't replace those hours because we don't have enough referrals. Remember I said referrals equals freedom, right? We don't have enough referrals coming in. So we can't replace those hours. So now you're Denise, the caregiver, and I just lost 8 hours of my 40 hours. That's 20% of my income. I just lost 20% of my salary. I can't make it as it is. I can't feed my kids. I can't pay for my cell phone bill. I can't put gas in my car, right? Let's just. I know I'm not exaggerating, right? This is our problem. It is our problem as an industry. If we're in this business, you're part of this industry, this is our problem. I can't put gas in my car. Think about the things that caregivers call and complain about, right? I can't get to work because I don't have enough money for gas, right? That's a very real problem because none of us on this call here could live off of what we pay a caregiver. So I'm not saying raise the wages. I'm not even going to tell you that. They're not asking for that, right? But just imagine that you just lost 20% of your week-to-week income and you're living paycheck to paycheck. What would you do? And you see McDonald's is hiring and they're going to pay you the same wage. You see Amazon is hiring and they're going to pay you the same wage. What would you do if you were in Denise's shoes? Yeah. I would leave and I'd go. Even though I love taking care of seniors. I could have a good working environment, even though I love it. That's why we need more referrals. Because we can't let this happen. And the other part of it that we need is increase your minimums. When you look at the home care industry, 20 hours a week is not a lot of time. What is our goal? What's our mission? What are we trying to do? I say this all the time. We are trying to keep people out of the hospital. Someone calls into my office. Care Choice was my company, right? This is my sales presentation binder that I would sit down and see how smelly and dirty and broken this thing is. I've had this thing since 2005, right? Our services were for as little as 4 hours a day, 5 days a week. That's what I used to say to people. I don't want that. I want somebody to come out once a week, twice a week. Ma'am, not on my watch. Am I going to let you end up in the hospital? I've taken care of over 1,000 seniors in my professional career directly. Now, over $1 billion, right? Or almost $1 billion in total revenue. I've helped coordinate care for like 90,000 people through all the people that I've worked with on helping them close and convert clients. I know what I'm talking about. Ma'am wants a bath visit twice a week. What else does she need help with? And when I come in, I'm going to say, ma'am, I'm going to help you find something that fits within your budget that we can provide to keep you home and out of the hospital. Because when you end up in the hospital under my care, I take that personally. And if the lady doesn't agree to it, then she can go with somebody else and let that happen to her with somebody else because I care about you too much to let that happen. This is a business, but it's also a truth. If somebody needs help with a bath, what else do they need help with? Simple as that. A bath, a shower is an easy thing to do 20 hours a week. Now it becomes a lot easier. Referrals equals freedom. Referrals equals what? Freedom. If I have a steady flow of 5 to 10 referrals every week coming in, when Denise here loses a client, there's another client already waiting for her. I proactively staff cases before their case ends. Like their case may end for Friday, today's Thursday. I already got a new case to fill this same time slot for next week. It makes it easier for recruiting when you have a 20-hour minimum too, because then you have like 15 possible shifts. There's only so many shifts that you can have. It's like 7 to 11, 8 to 12, 9 to 1, 10 to 2. There's your morning shifts, right? Then you have 12 to 4, 1 to 5, and 2 to 6. There's your afternoon shifts. That's it. And then you have your overnights. You have your evening shifts, maybe. And then you have your 24/7s, or 8 hours a day. Like there's only 15 possible shifts, and they're all 5 to 7 days a week. Make it easier for you. This is what we can deliver. This is what we can do. Oh, no, I don't want that. Then we're not the company for you. You have to be willing to walk away from the business. That's okay. That's a sales technique. Now, if you need help with this, this is what I do. This is all that I do, right? Here's how caregivers wish to be recognized. Look at this. 1, 2, 3, 4. Three. Recognition. And then they want the same things that we want. Some vacation time, maybe a bonus, gift card. All of those things we used to do at Care Choice. All of them. It's how we generated $5 million a year back when the state average was $21. State average now here in New Jersey is $26. So add $5 an hour, we'd probably be doing, if all else stayed the same, we'd probably doing about $6.5, $7 million just with the increase, staying competitive. Pay raise is one. Yeah, they want a pay raise. I understand that. I can't give you that, but I can give you all four of the other ones. It's fine. If you raise your rates every year, you raise it $1, give the caregiver a 75-cent, 80-cent raise per hour, and then the other 20 cents just to cover the taxes and whatever you have to do for the government on that. That's how you take care of your caregivers. That's how they want. Look at it. Verbal recognition by supervisor. How often do you call your caregivers and say, good job? Thank you for taking this case. I appreciate what you do for us. How's everything going at home? How are your kids? How well do you know your caregivers? Do you know all of your caregivers? I can tell you right now, my mastermind client who has a 33% turnover ratio, she knows her caregivers. As a matter of fact, you want to talk about recognition? She promotes from within. Her marketing rep used to be a caregiver. Her scheduler used to be a caregiver. Her operations manager used to be a caregiver. She's been in business for about 8-10 years now, and she has promoted people from within. She created a culture in her organization that breeds excellence and retains people. People want to work for her because they see that I don't have to be a caregiver for my entire life. Think about that, right? Company-wide recognition. Recognition by a client. That's powerful. That's what they got to do, right? Look at this. Here's caregivers actually want training. Can you believe it? They want training. They want to be better at their job. They want to be able to help more people. This is what they want. You want to retain people? Offer them training. CPR, first aid, medical training. They want it. Have a class. Any additional training that is offered. Look at that. If that doesn't say screaming for help, I don't know what does. Hands-on specific training. Try doing caregiver training. I talk about that. My clients, you know what I'm talking about. If you've been on my Fast Start program or in my advanced training classes with me lately, I spend a lot of time talking about special ops is another program I have. I talk about caregiver training almost every single one of those classes. Dementia, Alzheimer's training, and then specific CNA training. So if you're in a state where you have a lot of companions or home health aides, they want to become a CNA, pay for it, right? What does it cost to get certification nowadays? $350, $400? Well, if Steven is my caregiver and he's an awesome caregiver and he's been with me for a year, like offer these things as retention bonuses, I'll pay for you to get certified. I'll pay for this training for you. I'll offer this if you're with me for a certain period of time. Put in your due diligence, and this is what you'll get. That's what they want. So now, again, I want to just throw this out there to you. Some of you don't even know this. I started a company earlier this year called Mindful Caring, and we have clients all around the country who have created a culture that retains excellence, and it's a certification. It's a 6-month certification. The results have been staggering. Home Care Pulse puts out these things called promoter scores. What is a promoter score? It's when somebody is a client or somebody's a caregiver, how likely are they to go out and promote your company working for you? The industry average, if a client is on services, is 6.2% likely they're going to go out and recommend your services to someone else. Our clients who've gone through the certification now and they've been practicing it for at least 9 months, average is 8.6. 8.6 up from industry average 6.2. How about caregivers? The promoter score of a caregiver is 5.7. That means a little bit more than half the caregivers are willing to go out and tell their friends about you. Our clients, 8.7. 8.7. That is huge. If you need help with it, reach out to us. We can help you put together a caregiver retention program and completely change the culture of your organization. So now when you're getting those caregivers, you're losing fewer of them, you're getting more referrals, boom. Profits, more patients, you're helping, and everything else. So just think about that, all right? Last but not least, I'm getting to the top of the hour here, Medicare Advantage. I know you're all excited about this. You want this. If you want to get the Medicare Advantage, you have to do what the skilled agencies are doing. All right. At first, I thought to myself, like, wow, they're actually going to pay for private duty home care, and they're going to take care of all the private companies out there and do all this. They're actually going to pay for this. And then I started to realize, wait a second, no. Because if I'm Medicare or the Advantage plans, right, if I'm a Medicare, if I'm a government or a payer source, I don't want all the home health companies that I'm paying already in the United States. They put regulations. That's why a lot of companies, like a third of the companies that existed years ago, have gone out of business. A lot of them have. Now, more people are getting into it, but a lot of people are going out of business, or they're selling and becoming bigger and bigger, like fewer payer sources, more people per company, right? So at first I was thinking, oh, they're going to offer this to private duty companies. But then I started thinking, no, because there's no standard. There's no industry standard. That's why most of us on this webinar have not received any information about it, and we don't know how they're going to pay for it. And they're not talking at conferences and the associations and everything else, because they're going to give it to the Medicare skilled agencies to provide it through them, right? So if I want to get Medicare dollars, I have to do what the Medicare agencies are doing. So here's the first thing I recommend you do. Be proactive. Call up AARP. Call up the Humana Advantage and all the other ones that exist that are in your area. Speak to your skilled agencies. Ask them what are the insurance providers, and find their numbers and call them and ask them, how can I be receiving this benefit? What do you need from me to be able to receive it? Don't wait for them to call you, because I'm going to tell you, they're not. Find out, be proactive on it. If you want to get that, be proactive. Do some research in your area. Find out what's required. Second, get accredited. I know it sounds crazy. Accreditation, Steve, costs like $20,000 to get accredited. Yeah. And when you're accredited, guess what? You can accept insurance. And the accreditation, JCO, CHAP, CAC, all these different organizations accredit businesses. It's a quality assurance that means that you dot your I's and cross your T's and meet the industry minimum acceptable requirements to provide care. You are now qualified to receive dollars. Just throwing it out there. Here in New Jersey, it's required that you have it anyway by 2020. So everybody's getting it. One of my clients here, we were talking about this last week at the mastermind meeting, and I was saying, you're accredited. Guess what? Go after that Medicare Advantage. You're accredited. You meet their standard. Call them up. Get clients. Be able to manage your cash flow properly. Think about the nature of insurance for a second. All of my home health companies understand this. There's a reason why it costs so much money, because you have to be able to float salary, payroll. You have caregivers. You have people who are out there working, right? Medicare and these Advantage plans, they're not going to pay you right away. They're not going to pay you on time. You kidding me? You're going to get paid 90 days later if you're lucky. So it means you have to float 3 months, 4 months salaries to be able to withstand that, and then you'll get a big lump sum. You might get like $100,000 at one time, but remember, you were floating it, and it's like 30 days. So you'll be floating 60 to 90 days while you're getting the 30 days that happened beforehand. So when 120 days come, you're going to get the first 30 days. So you're always going to be 60 to 90 days behind. That's just how insurance pays. So if you want that business, and that's why I say if you want that business, and the good thing I can tell you, because I know people who are getting it, I actually have some clients in certain states who have home health and private duty, and they're the ones who are piloting it, all right? So I already know they pay you your reimbursement. So if you're charging $25 an hour, they pay you $25 an hour. But just remember, you have to be able to float that. And what kind of capital is that going to look like for you to be prepared for? It's a great time. Don't get this wrong. This is a great time to be in healthcare. The largest demographic of the United States is retiring at an alarming rate. Do you also know that not only are they the largest demographic, they also have the highest purchasing power? Like everybody's talking about millennials and Zeners and Zennials, right? Like I'm a Zennial because I was born 1980, so I'm between X and a millennial, right? That's what I am. Let me tell you, folks, I'm the richest one of all of my friends, right? So my generation does not have a lot of money, all right? The millennials are just getting started. They don't have any money, okay? The people who have the resources are the baby boomers. They're the ones that are going to be our clients in the next decade. So opportunity is vast. Like, home care is a great business to be in. But be prepared for all of these things that I'm telling you if you want to get the Medicare Advantage. Does that make sense? Yes or yes? Yes. All right. And then track your readmission rates. Do what the skilled agencies do. And don't lie to me and tell me, we track our readmission rates. I know right now that 19% of you do. There's 200 people on here. 38 of you track your readmission rates. All right. And the other 162 do not. The majority of us do not track our readmission rates. So you're not doing medical, you're not taking it and treating it like it, you're not going to get Medicare reimbursement. It's not going to happen. We have to meet the standard of the people paying for it. So if you want to get the money, you got to meet it. And then last is power partner. This is huge. A lot of Medicare skilled agencies don't want to get involved in the private side of the business. This is where you power partner. And you talk to your Medicare providers and say, hey, how about we do the fulfillment for your company on that? And then you pay us accordingly. But to have that conversation, you need to be doing all of the things that I said above it. Because if I owned a skilled agency and I'm taking care of 400 patients at home and I could get that Medicare Advantage money, yeah, I'll outsource it to you. I'm going to keep $1 an hour and give you the rest of it. But I'll outsource it to you, sure, no problem. That makes a lot of sense. So we can all work together and make this happen. But I'm not going to just give it to you because I like you. What are your statistics? What are your stats? Are you accredited? Are you this? Are you that? That's what I would do if it was me. So again, take it for what it's worth. Disclaimer, proceed with your own, caution, expense, or whatever. But from what I see as an industry leader, as an authority, that's how I would take care of things. All right? And so I'm going to stop here. I have 2 minutes, so I'll take the questions that I see here in your question pane. I hope this was good. I hope you got a lot out of this, and you learned something, and you're better prepared for next year. So let me see. Oh, my goodness. You guys got a lot of stuff here. Awesome. All right, so here we go. So Glenn is asking a question here. My question is, are you aware of direct caregivers? Is the government plan to regulate the caregivers so that they can apply in the agency instead of applying directly to the elderly? I'm not sure I kind of understand the question here, so I'm going to go on to this next question that you're asking me here, Glenn. What can you do if the client wants only one caregiver for 7 days? Charge the client accordingly. Explain to the client that there's overtime. They want the overtime. That's fine, but you have to pay the time and a half if you want it and the caregiver is willing to do it. More often than not, the client's going to agree to it and make it happen. Very good question, Glenn. Next question I have, I want to shoot down. Glenn, you asked like 15 questions, so holy crap. Let's see. Paul asks, we are in talks with a medium-sized home care franchise to open in Illinois in 2019. Is home care still viable with all the competition, rising costs, lower of lifetime expectancy of a client, as per my slides? So, Paul, that is a phenomenal question. You have to take your own risk tolerance assessment. Do I think home care is a worthwhile business? Yes, if you understand your operating expenses in that first year. Many people out there are taken for a ride when they get this, I have $10,000 and I can start a home care business. And then they start a business and they're like, oh my God, there's all this stuff I got to pay for. It took a lot more. Realistically, first year, expect $100,000. That's buying into your franchise, and that's $50,000 to get through the first year. And as long as you're aggressive and you're out there, yes, you can do this. Because think about it from this perspective, Paul. You have a franchise. You have a business. If your business is generating $2 million a year, you can sell that at some point for $1.2, $1.3 million, not to mention the profits that you're making all the time. It's like real estate. So you have this business that you built. It has equity and a net worth that you can get one day when you retire. So 5 years, 10 years from now, you grow it, you flip it, you sell it. Like I'm a serial entrepreneur. Brian, who is my boss at Caregivers, he's a serial entrepreneur. So we grew the business. He worked it for 10 years. I worked it with him for 7 years. We turned around and flipped it and sold it for several $1 million. He retired at 48 years old, right? Retired, doesn't work anymore. The economy was terrible. It was like 6,000, 7,000 points when we sold. He put all his money into the stock market. Now it's like, what, 23,000, 22,000 points? He made like 3 times his investment back, and he's retired. It's ridiculous. So is it a worthwhile business to get into? Yes, but just be aware of all the things I said, and then judge your own risk tolerance. Think about it. You could open up, like I always say this, you can open up a McDonald's. You can. But McDonald's is going to cost you $2 million to start up, whereas this could start, $150,000 to start up. You can open up a Dunkin' Donuts, and I guarantee you're going to do well, but it's going to cost you $1 million, $1.5 million to open up that Dunkin' Donuts. So, when you look at the cost of getting started to the cost of, return on investment, home care is a very viable business to get into. But just understand the true cost behind it. And if you're willing to do all of that, then it's a worthwhile investment. That is an excellent question. Excellent question. Accreditation. I'm licensed. Do I still need to be accredited? Where did you get your license, Dahlia? What is the accreditation for it? All right. That's what you want to think about there. Were you CAC, CHAP, JCO, whatever the accreditation, are you actually an accredited agency? It's different from getting a license. Like New Jersey used to be, you get a license and it's based on needs and care and everything else. That's different. All right. And then the last question I'm going to take here, I'm sorry, like 15 other questions here, but are there going to be a replay? Yes, there will be a replay. You can watch it. It will not have me drinking wine with you, so I'm sorry about that. I finished the glass in there. I hope I did good. All right. I hope you enjoyed your drink with the hurricane here. I love you all very much. Again, happy Hanukkah. Merry Christmas to each and every one of you. And together, understand these things. Like, I want to put this out there again. I didn't do this. I don't want to scare you. I'm just telling you the state of home care, because this is a great business to be in. But you have to know what you're getting involved with, all right? And do it right, because if you do it right, the potential is endless. Do it right. If you need help, I'm here for you. Call us, email us. Let's do business together. Let's make 2019 your best year yet, all right? I love you. God bless each and every. I pray for you every night. I'm telling you, I kid you not. I pray for each and every one of you. I love what you're doing. Continue on your mission. Let's make 2019 an amazing year, folks. God bless. Good night.